Now that we've studied the details of the upper limb in lessons 13 through 17, let's take an anatomized journey through that remarkable appendage. We'll begin by reviewing the bones of the upper limb from shoulder to fingertips. So let me adjust the table so we can focus just on the upper limbs. If you remember, the two bones of the pectoral girdle are the clavicle and the scapula. The clavicle articulates at the sternoclavicular joint with the sternum. Let's take that off. And now we can see the clavicle articulating laterally with the acromion process of the scapula. If we take the clavicle off, we can see the scapula in its entirety, and we can see the superior angle, inferior angle, this medial or vertebral border, the lateral or axillary border, and we can see the coracoid process that sticks out anteriorly, as well as the acromion that projects laterally. And if we flip over to look posteriorly, we can see how the acromion becomes one with the spine of the scapula. At that acromioclavicular joint, the acromion progresses posteriorly, and here we have the spine of the scapula. This is the infraspinous fossa below the spine of the scapula and the supraspinous fossa above the spine of the scapula. And if we rotate a bit, we can see how the humerus sits in the glenoid fossa of the scapula. Now let's remove the scapula and clavicle, and we'll rotate to look at the anterior surface of the humerus. Again, we see on this side of the body how the head of the humerus articulates with the glenoid fossa. And we can see the lesser tubercle projects anteriorly, the greater tubercle projects laterally, and between them is the intertubercular groove or sulcus. As we progress distally, we see the deltoid tuberosity, where the deltoid muscle attaches. And then when we look at the medial epicondyle, we see it projects more medially than the lateral epicondyle. And here are the supracondylar ridges. This medial epicondyle, remember, is a major site of attachment for muscles of the anterior forearm, whereas the lateral epicondyle is a major muscle attachment site for muscles of the posterior forearm. Medially, we see the trochlear region of the humerus that articulates with the ulna to form the hinge joint at the elbow. And laterally, we see this rounded knob called the capitulum that articulates with the head of the radius. If we want to look at the posterior aspect of the humerus, again, we see the head and the greater tubercle, the deltoid tuberosity, the smooth shaft, and a depression between the epicondyles known as the olecranon fossa that receives the olecranon process of the ulna posteriorly when the elbow is extended. This brings us to the elbow joint complex, where we have three distinct joints. The humero-ulnar joint between the trochlea of the humerus and the trochlear notch of the ulna, the humero-radial joint between the capitulum of the humerus and the head of the radius, as well as the proximal radio-ulnar joint where the head of the radius spins against the ulna. So now let's remove the humerus and let's take a look at the anatomy of the radius and ulna. We can focus on the head of the radius, this rounded knob followed by a constricted neck. If we turn slightly, we can see the radial tuberosity for insertion of the biceps brachii muscle. If we go distally, we see that the radius widens for articulation with two of the carpals, the scaphoid and lunate. There's a styloid process that's kind of a point on this end of the humerus distally. If we focus on the ulna, I can adjust the position a bit, and we can see the trochlear notch. We see the olecranon process as well as the more anterior coronoid process. If we follow down the ulna distally, you'll see its head is at the wrist. And there's a prominent styloid process on the distal end of the ulna as well. Let's take a look at the 8 carpal bones of the wrist. If you remember, they're in 2 rows, and from lateral on the thumb side to medial on the little finger side, we have the scaphoid and the lunate. And remember, those are the 2 that articulate with the distal radius, as well as the triquetrum, which has the pisiform stacked on it. In this distal row, from lateral to medial, we have the trapezium by the thumb, the trapezoid on the inside, and then we have the capitate and hamate. If you remember, the hook of the hamate, as well as the pisiform bone, form the medial attachment for the carpal tunnel, while the tubercles of the scaphoid and the trapezium form the lateral or thumb side articulations that receive the other end of the carpal tunnel. Now we have the 5 metacarpals, the first metacarpal of the thumb, followed by the second, third, fourth, and fifth. And remember, those are numbered with Roman numerals. Each has a base, a shaft, and a head. In the phalanges, at our metacarpophalangeal joints, we have a proximal and distal phalanx for the thumb, while each of the other fingers has a proximal, middle, and distal phalanx. And those are the interphalangeal joints that unite adjacent phalanges. The phalanges each have that base, shaft, and head theme. Even the small ones, like the distal phalanges, are said to have a base, a shaft, and a head. So that concludes our journey through the bones of the upper limb from shoulder to fingertips. Let's use the high-resolution feature in Anatomage to take a closer look at the ligaments of the shoulder. Here we can see an anterior view with the acromioclavicular ligament highlighted. Here's the coricoclavicular ligament with its conoid and trapezoid portions. Here's the coриcoacromial ligament, and we see the coриcohumeral ligament. If we tilt up, we can see the glenohumeral ligaments. Here's the superior glenohumeral ligament, the middle glenohumeral ligament, and the inferior glenohumeral ligament that all help reinforce the anterior aspect of the shoulder joint capsule. And finally, here's that transverse humeral ligament that holds the tendon of the biceps, the long tendon of the biceps, in that intertubercular groove. Let's key in on the elbow joint, the ligaments of the elbow joint. We can see the ulnar collateral ligament that attaches the medial epicondyle down to the ulna and stabilizes the hinge joint. And we can see the radial collateral ligament of the elbow that passes not to the radius itself, but to the annular ligament that surrounds the radius. Now that we've covered the bony background of the upper limb, let's take a look at the muscles. We'll start with the shoulder and work our way to the hand. If you remember, the shoulder muscles are really quite complex. Most of them are innervated by branches of the brachial plexus that come off early, before the main terminal branches. So I'm going to remove them one at a time as we talk about these muscles. So first we have a pair that originate all or in part from some aspect of the axial skeleton and attach to the humerus. Anteriorly, we remember pectoralis major, and then it's a muscle that we consider with the chest, but it's really an upper limb muscle. It flexes, adducts, and medially rotates the humerus. If we flip over posteriorly, we see a companion muscle that shares two of the three functions with pectoralis major. Here's latissimus dorsi, if you recall, and it also inserts anteriorly with pectoralis major. A second series of muscles attach the axial skeleton to some aspect of the shoulder girdle, either the clavicle or scapula. So let's take a look at those. These muscles primarily act on the scapula. Trapezius is a review muscle for us because even though it's located on the back, its job is to really operate the upper limb. If we remove trapezius, we can see again levator scapulae coming off the superior aspect of the scapula, and we can see rhomboid major with rhomboid minor more superior to it, and all of those muscles are attached to the scapula and operate it. If we turn anteriorly, we can see more anterior muscles that are also going to go from the axial skeleton to either the scapula or clavicle. And here we see pectoralis minor and subclavius. Serratus anterior was also covered with the chest, but it's really a muscle that operates the scapula. Now we can turn to a group of muscles that connect the shoulder girdle to the humerus or even to the radius or ulna. Anteriorly, we see the anterior aspect of the deltoid muscle that makes the cap of the shoulder. Its anterior fibers will help flex, posterior fibers will help extend, but it's mainly known as a muscle that abducts the humerus. If we take that off, we can see biceps brachii. Its two heads both attach to the scapula, and the long head sits in that intertubercular groove on the humerus. It crosses the shoulder and the elbow joint, but is more associated with the movements at the elbow. If we remove the biceps brachii muscle, we see coracobrachialis, another muscle of the arm region. It goes from the coracoid process down to the humerus. And if we turn over, we'll be able to see some other deeper muscles of the shoulder region. We see triceps brachii. Let me remove the deltoid muscle posteriorly on this opposite limb so we can see the triceps brachii. That's a major extensor of the elbow. But even though it's more associated with movements at the elbow, its long head does cross the shoulder joint. If we remove the triceps brachii, we see the posterior aspect of the humerus. And then we can also see teres major. Teres major is not a muscle of the rotator cuff group, but it comes out anteriorly and attaches to the intertubercular groove. Remember the lady between two majors? Teres major was one of those majors. And then finally, we can take a look at the rotator cuff muscles. These all help support and reinforce the shoulder joint. We have supraspinatus that sits in the area above the spine of the scapula. We have infraspinatus that sits in the infraspinous fossa. And we can see teres minor, which is a muscle of the rotator cuff group. And all of those muscles make a cuff that surrounds and stabilizes the head of the humerus in the shallow glenoid fossa. Anteriorly, we can see the fourth and final rotator cuff muscle, subscapularis, that helps reinforce the anterior portion of the shoulder joint capsule. And there's where it sat in the subscapular fossa. Now that we've covered the shoulder complex, let's take a look at the arm. And remember, arm is specific to the area between the shoulder and the elbow. I've restored some muscles so that we can look at them again because certain muscles act primarily on the elbow as well as across the shoulder. Anteriorly, we see biceps brachii, and we see coracobrachialis, as well as the brachialis muscle. And all three of those muscles are supplied by the musculocutaneous nerve off of the brachial plexus. If we rotate posteriorly to look at the posterior compartment of the arm, it's dominated by triceps brachii, the prime mover of elbow extension. And its three heads come off as one on the anatomage table, and its little assistant buddy, anconeus, is a small muscle that is just distal to the elbow joint itself. And those are the muscles of the arm region. The triceps brachii and anconeus are supplied by the radial nerve off the brachial plexus. Now let's take a look at muscles of the forearm. We'll start anteriorly. We've switched to the high-resolution portion of the anatomage table so we can look at detail of smaller areas like the forearm and hand. Let me first show you the context of the muscles of the anterior forearm, and then we'll remove them. So first we have pronator teres, followed by flexor carpi radialis on the thumb side. This person happens to have a palmaris longus inserting on, that's the variable muscle, and here we see it inserting on the palmar aponeurosis, followed by flexor digitorum superficialis with tendons that go to the middle phalanges, and then flexor carpi ulnaris on the little finger side. All these muscles are supplied by either the median nerve or the ulnar nerve, and they either flex the wrist or digits, and most have good names that tell us what their function is. So let's remove those and look at the deeper muscles. Here's pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris, and here again is flexor digitorum superficialis. Those are the 5 muscles of the superficial aspect of the anterior compartment. Now, if we want to look at the deeper muscles, 3 muscles of the deep anterior compartment, we see flexor digitorum profundus, flexor pollicis longus to the thumb, and if we remove those, we can see the pronator quadratus, the quadrangular muscle whose counterpart is at the elbow. The interosseous membrane would sit in this region and divide the anterior compartment of the forearm from the posterior compartment of the forearm. So let's take off pronator quadratus and turn to the posterior aspect of the forearm. All of these muscles are supplied either by the radial nerve or by its posterior interosseous branch. And we can see the outcropper muscles that help operate the thumb, also known as the snuff box muscles. There's the anatomical snuff box. And they divide the superficial posterior forearm into a superficial lateral group and a superficial posterior group. Remember, the superficial lateral group can be seen at the edge of the elbow. And it consists of 3 muscles. Let's identify them first. Here's brachioradialis, followed by extensor carpi radialis longus and extensor carpi radialis brevis. The posterior superficial group consists of extensor digitorum with its tendons down to the posterior aspect of the digits, and we see extensor carpi ulnaris to the medial aspect of the wrist, and the extensor digiti minimi to the small finger, the little finger. If we remove those, we see those outcroppers, or snuff box muscles as they're called. Here is abductor pollicis longus, extensor pollicis brevis, and extensor pollicis longus. And there's the anatomical snuff box. If we remove those, We see the final two deep muscles of the posterior forearm, extensor indicis to the index finger, and the supinator, which, remember, allows a pronated hand to be supinated at the elbow. So let's remove those and we'll transition to the hand. Let's turn now to the intrinsic muscles of the hand. Remember, to be intrinsic, a muscle is entirely contained within the hand itself. So first we have to remove the palmar aponeurosis, and let's remove the palmaris longus that attached to the palmar aponeurosis. Now we can see the muscles of the thenar group, the muscles of the hypothenar group, as well as mid-palmar muscles. Let's start with palmaris brevis, and we'll remove him. Now we can see the muscles of the thenar group and the hypothenar group, as well as mid-palmar muscles and tendons of the anterior forearm that pass to the hand. If we look at the thenar group, we see abductor pollicis brevis and flexor pollicis brevis, but we need to remove those to see the opponens pollicis muscle that's deeper in the thenar group. If we switch to the hypothenar group, we see abductor digiti minimi and flexor digiti minimi, and again, the opponens digiti minimi is deep to those two. We can see the tendons of flexor digitorum superficialis that have to split and allow the tendons of flexor digitorum profundus to pass through. Let's remove the tendons of flexor digitorum superficialis, and we can see the lumbrical muscles that attach to flexor digitorum profundus. Let's highlight those, and we can see their attachment, and then let's remove those, right? So with the tendons of flexor digitorum profundus removed, we can now see the adductor pollicis in the web of the hand. And if we remove that, we can see the deepest muscles, the interossei that go between the metacarpal bones. First, we have the palmar interossei, and if we remove those, we can see the dorsal interossei. And the dorsal are actually better seen on the dorsum of the hand. So that concludes our study of the muscles of the hand. I hope this excursion into the upper limb has helped aid your understanding of this remarkable appendage that contributes so much to our daily lives.